So when we look into the research on magnetic stimulation, the first thing to understand is that there's some very antiquated and less effective technology included in the meta-analysis. Even so, the 2018 meta-analysis stated the pooled data for the objective cure rate of stress incontinence was more likely in the active treatment group. Likewise, the pooled subjective cure rate was significantly higher in the active stimulation group, and furthermore, more patients in the magnetic stimulation treatment group exhibited improvement in incontinence symptoms. So one question remains: how effective is the advanced technology used in the Pelvipower magnetic trainer? To get a more accurate reflection of the effectiveness of Pelvipower, we need to delve into the recent research that's actually applicable to it. The Journal of Urology published this 2017 double-blind randomised controlled trial comparing magnetic stimulation to sham in the treatment of female stress incontinence. It was JDAD level 5 and it had a follow-up of 14 months, so it reassessed a full 12 months after therapy ended. Keep in mind that research on pelvic floor muscle training has follow-up ranges from nothing to 3 weeks, 6 weeks, 3 months, and the most I've ever seen was one with 9 months. So to have a follow-up of 14 months is pretty respectable. At 14-month follow-up, the responder rate, which was already a respectable 75% immediately after therapy, had only dropped by 5% to 70% 12 months after therapy. The treatment group still had a 7.13 point reduction on the ICIQ urinary incontinence short form score. The objective cure rate was still 58%. Pelvic floor muscles were between 25 and 50% stronger than baseline starting measures, and 75% of people still reported feeling better or very much better. Basically, every primary and secondary measure of urinary incontinence and pelvic floor strength showed statistically significant improvement, even 12 months after the treatment ended. This research is reflective of the typical results we see firsthand in clinical practice.